Okay, so let's go over admission, transfer, and discharges. This is probably not super new information for you, especially if you've ever been a patient in a hospital or have visited anyone in a hospital or a facility of any type. It's pretty standard everywhere that you go. So we'll just talk about the very basics. So admission is the official entry into a healthcare setting. So that can be a hospital, it can be long-term care, it could be subacute rehab, any facility where you are an inpatient. So the first thing that needs to happen are that orders need to be written by a provider. This is not a nursing measure unless it's a nurse practitioner. Somebody has to have admitting privileges to that facility. Once that order is written, like admit to med-surg or admit to ICU, then that person is admitted. The nurse's role is to complete a history and to do an assessment, a head-to-toe assessment on that person. So if you've ever been a patient in a hospital, you've probably experienced this where they ask you 1,001 questions and check every crevice of your body. That is something that you will learn in your first semester of nursing school, is how to complete that process. It's very, very important for all that information to be gathered so that we know how to properly treat that person. Once that happens, the nurse will move into the next phase of the nursing process where they'll create a plan, write some nursing care plans, and give them diagnosis and all of that. The CNA's role, so your role in this, is to take the vital signs, to orient that person to their room, let them know how to get a hold of people, how to use the call bell, how to use the phone, the TV, where the bathroom is. So getting them used to their environment. During the admission process, we also get consent, so like consent to treat, and any consents for anything that we're going to be doing. Something that you should realize during this process is that it's usually pretty stressful for the person. Nobody really ever wants to be admitted into a hospital or into a long-term care setting, so this person's going to be under a lot of stress, and you already know when you're under stress, sometimes you have a hard time focusing and paying attention. So make sure that you're being patient and calm. Try to get out of your head that this is just your daily job, and realize that for that person, this is a very stressful situation. So don't be surprised if you see a lot of emotion from people during this process. I'll never forget admitting one lady, and I was just going through my little routine of admission. You know, you get admissions every day. It's no big deal as a nurse. And then she suddenly started bursting out in tears. And I realized, this is stressful for her. So remove yourself from the situation and put yourself in that person's shoes. Empathy. This is where empathy comes in. So transfer is from either one room to another. So we might, for example, move somebody closer to the nurse's station if we're worried about them. It could be from one unit to another, either upgrading or downgrading. So, for example, someone could move from the ICU to med-surg if they're getting better, or from med-surg to the ICU if they're getting worse. And then facility to facility. So this would be a change in the level of care. So, for example, Miss Jones is in long-term care. She falls and breaks her hip. Now she needs to go to the hospital. That is a change in facility. Your role in a transfer is to make sure that it is a safe transfer. You need to make sure that everything goes along with that person. And you may need to give report to whoever is taking over their care. Usually this is the nurse's role, so if I'm working, in a hospital, I'm getting ready to discharge somebody back to long-term care, I would call and give report on that person, let the nurse that's going to be taking over that person's care know what's going on with them. And there's a whole format that we use as nurses to give report from one nurse to another. And you'll learn about that in nursing school. So discharge is the official exit from a facility when a person is officially released. So the physician or nurse practitioner will write orders discharging that person to home or to rehab or wherever they're going. Of course, a discharge could also be unofficial, somebody leaving against medical advice. So, they're not prisons and we can't keep people against their will. as long as they're in their right mind. So if I'm in my right mind and I don't want to be a patient in this hospital anymore, I have every right to walk out, right? But we need to make sure that that's hopefully done in an orderly manner. We need to have a form signed called an AMA form, against medical advice form. So your role as a CNA would be to let the nurse know that this person is leaving. The nurse would need to be the one to get that form signed. And if we can, we try to talk the person into staying if it's in their best interest to stay, but we certainly can't force them to stay if they're in their right mind and they want to leave. It's a different situation if they're not able to make their own decisions, like if they have dementia or if they're under the influence of something and they're not able to make a rational decision. That has to go through a whole nother process. We always plan discharge the moment someone is admitted. So that's what happens during that admission process with the nurse, where they're asking 100 million questions, which seem like silly questions sometimes, like how many steps does it take to get into your house? But the reason that we're asking those questions is because we need to plan for discharge. So if I know you have 15 steps to get into your house and you just broke your hip, I know that I need to send a trigger maybe to physical therapy. If I am doing my admission and I find out you've lost 15 pounds in the last month, I may need to send a trigger to nutrition, because I don't want to send you home in an unsafe condition, right? So the planning always starts at the beginning. We don't want to be scrambling at the end trying to figure out what we're going to do now. The responsibility for the CNA during a discharge is to make sure that all belongings leave with that person, to help them get dressed and ready to go, and to assist them to the vehicle. Usually in a hospital setting, we take people out by wheelchair and make sure that they're in their vehicle and safe to go before we walk away from them. So, very simple process. It'll be just about the same wherever you go. Make sure that whenever you get hired to a facility, you find out what any other rules are for that specific facility.